So every time you get a new bottle, you're going to have a cap on like this that just pops off. So I just popped it off like that. And you can throw that away.
Oh, you throw it away? Okay.
Yeah. Let's just take a look at everything they gave you. So they gave you 2 different sets of needles in 1 syringe. So these are a little bit fatter, so you're going to use these to draw up the medication, and then you're going to switch to these to inject. Just make sure that these are 22s.
So Josh's. Okay.
These are 20s, yeah. So first thing you want to do is wash your hands.
Oh,
yeah, that white one. Oh, there's no bag in there, but that's okay. So the trick is just to keep everything super clean.
Okay. And that's the whole thing of like switching the needles, or one's just thicker, it doesn't go in as well? Or?
The reason you switch it, a couple reasons. The ones that are attached to the syringe now are bigger, so it's easier to draw the medication up because it's really viscous. It's suspended in oil, so it's really thick. Also, whenever you puncture something with the needle, there's little like shards on the needle, and it makes it harder to go from like one thing to another thing, like to put it in your skin. So you switch it so this is a little bit littler and it's sharper.
Okay.
It's already been dulled.
Better to pierce the skin.
Yes. Yes. Okay, cool. Have a seat here. So alcohol swabs, you can buy a ton of these at Walgreens for, you know, just a couple bucks.
Okay.
So here it says inject 1 ml intramuscularly every 2 weeks.
Okay.
So this is a 3 ml syringe.
So we'll go to that one.
Yeah, exactly. 1, 2, 3. So you're gonna go to there. Go ahead and clean the top of this off with the alcohols.
Okay.
And you can always just throw it away.
Okay.
And then to open this up, they have 2 lips right here. You're just going to pull that apart and take the syringe out. Great.
Alright.
So the tips of these, they unscrew. So you just want to make sure that it's screwed in really tight.
Oh, okay. So that's how, that would be nice to do.
Yeah, you can kind of play with that. So that's how you do that side to side. Great.
Okay.
Okay, and then to get the medication out of the bottle, what you're going to do is fill the syringe with air up into the dose that you want.
Okay.
So pull that down to 1.
Which part? The second lip?
It's going to be the bottom of the mountain. See how there's like that little mound right there?
Oh, the mound? Okay.
Yeah, so the top. Perfect, right there.
Right there?
Yeah, absolutely. And then this comes out going straight off. What I like to do is just hold it with both hands, because if you pull it like this, you could stab yourself. So if you just kind of hold it with both hands and pop it off with your thumbs while you're supporting it.
Okay.
That way you don't stab yourself. But however you can get it off. Perfect.
Okay. Where's this going?
What do you say?
Where's this going?
It's going to go into the bottle.
I mean, like, which part of my body?
Oh, in your leg right here.
So, I mean, I have boxers on. Should I strip now, or does it
No,
go through my pants?
what we'll do is we'll practice filling up the medication,
Okay.
and then we're going to set that aside, and then we'll use the fake lab to practice injecting, and then we'll actually do the injection. So we'll do it on parts. So right now we'll just picture, or we'll just work on getting the medication out. So what you can do is flip the bottle over, upside down, and then this is a rubber stopper. So even if the needle's in there, no medication is going to come out.
Okay.
So you can go ahead and put that in the bottle.
How deep?
You can go all the way in if you want.
It always needs to be like straight up to down, right?
Yeah.
And just in the middle ring?
Yep.
Okay. Okay.
So what you're going to do now is inject the air that's in here into the bottle. And so that kind of creates that pressure where it's going to then seep back into the syringe.
Okay. Oh, I see it.
Yeah. What I like to do is actually pull back. This is the plunger right here. You can pull back on that and fill the syringe up past the dose mark, because if there's any extra like air bubbles or anything, or extra medication, you can just push it back into the bottle with the bubbles. So even if you go down to like 1.5, that's good.
Okay. Assume you get a little bit faster with this as you go.
Oh yeah.
Okay.
Cool. And then go ahead and push up to the 1 mark. There's an air bubble here. You're going to feel it pop when you go in. Great.
That's what she said.
Okay.
Nice. And then you can pull the whole thing out of the bottle.
Do I leave the bottle upside down? It doesn't matter.
It doesn't matter. Good job.
Okay.
Great. So when your bottle's a little bit lower, like when you've used most of your tea, when you're filling it, just make sure that the tip of the syringe is actually in the juice, because if you're pulling back, you'll be like, where's it coming?
Okay.
Yeah. Cool. So at this point, what we're going to do is switch the syringes. So just for safety, if you leave this on
and then you can just go like that.
Exactly, yeah. And then pop that in. Great.
Can I just get a shot of the dose mark too, just to make sure that you have that for later?
Excellent.
Alright, and just pop it on.
Yeah. Feel like a snap.
Okay.
Great. And then if you imagine, right now there's hormone going all the way up the syringe, so if you were to unscrew it to switch the tips, it would seep out.
Right.
So go ahead and pull some more air in there, just to get it out of the tip.
Alright.
Good job. And you can go ahead and unscrew that.
Okay.
Awesome. And we're all set with this one, so we're going to put that in the sharps container. Okay, and with this, this is sort of like flimsy plastic, so what I like to do is just keep it clean, pop it out of the side here and screw it in like that.
Okay. And I shouldn't like tip this over, right? It would
Right,
pop out.
yeah. It probably wouldn't spill out, but it has that potential.
Okay. And it pops in?
You actually can screw it in,
Okay.
yeah. Great.
Okay.
So then, just to make sure it's all, locked and loaded, if you want to take this off to see the tip, you can, or if you can see through it, you're just going to push up on the plunger to push all that air out.
Until I see like it squirt a little bit?
Yeah, just like a little bead of hormone at the tip.
Okay.
Great. So at this point, what we would do is clean your leg off and inject, but we're going to set it aside and use our fake leg.
Okay.
Okay. So, is it okay if I touch your leg?
Yeah.
Okay. So good injection sites. It's good if you put one hand on your hip and then one on your knee. It's sort of the area in between.
Okay.
You want to make sure that you're going into a muscle because it's a muscular shot. So when your pants are down, if you go like this, you'll be able to see like kind of that crease.
Right.
And that's where you want to go in there.
Okay.
So, also you want to rotate sites. So left,
every
right,
day?
left, right. Yeah, every injection.
Okay.
Just so you're not.
Yeah, right. Every injection.
Yeah. Okay. All right. So this is going to be our fake syringe. Every time this is filled to your 1 ml dose. So what you're going to do is you pick your spot. If there's any like obvious veins, you can just avoid those.
Okay.
So you're going to clean it off. What I like to do is like put it like this, circle it out, so you're not like
Okay.
spreading
Makes
bacteria.
sense. All right.
So just take your tip off. First thing you want to do is pinch. It doesn't matter which hand you use for either. It's like whatever feels comfortable. So you're going to pinch with one hand and then go straight in with the syringe. A lot of people get psyched out here. You just got to go for it. Like the more you dwell, the worse it is.
Right.
So you're just going to go straight in. And then what we're going to do is check to make sure that the tip of the syringe is in the muscle and not in a vein. And to do that, what you can do, you can let go with this, and then with one hand, doesn't matter which one, hold onto this really tight, and with the second one, you're going to pull back on the plunger.
Okay.
So you're looking for one of two things. What you want to see is a little air bubble come out of your leg. If you see that, you're good to go. You can inject.
Okay.
If you see a flash of blood, you haven't hurt yourself. It just means that the tip is in like a vein or something, and you don't want to inject in there.
Okay.
So what you would do in that case is just pull out, throw everything out, start again on the other leg.